Sometimes it's a thickened area of bone. Okay? Those are referred to as superciliary arches. All right? The point right here between where's a superciliary arch there, a little protruding arch here, and the depression behind them is referred to as glabella. The frontal, single frontal, articulates with the right and left nasal bones near the top of the orbit. And that point right there, where the frontal bone and the right and left nasals all come together, has a name which is appropriately called nasion. And sometimes you'll see nasion listed. Okay, so here's the supraorbital margin. Again, the orbital surface. There is a little notch here. Yeah.
What's glabella again?
If you look on the top of the orbit, there should be a little bitty protuberance, the upper ridge of the orbit, a little sort of like minor brow ridges called superciliary arches. The area where there's a depression between these two is referred to as glabella.
So it's a depression between the two arches.
Yes. So here's an arch here, here's an arch there, and that's the point right there.
It's like this is their like an eyebrow, and then right where they
feel that there.
right like space in between.
So it's almost like that.
Moving right along. Does everybody find glabella?
Oh, is it right here?
It's obviously more obvious in some individuals than others.
Like right
Yeah,
there?
you feel that. There's an area in the middle that's not part of the arch.
Yeah.
Right where it's cut. Okay, so here, nasal orbital surface, supraorbital margin, we've got that. So up here, like I say, just above, about a third of the way here, from the midline out in the supraorbital margin, there's either a foramen or a notch. And that's where a nerve that we will learn about later comes from in here and then goes up and supplies sensory and motor to some muscles up here and also the skin above there. So you see a little supraorbital notch. Sometimes it's a notch, sometimes it's a complete hole. Okay, so let's move into the ones below that are still forming the orbital margin. Here's that cheekbone, the zygomatic bone. It has an orbital portion, so it forms the lateral surface on the inside of the orbit. Okay, that's this area here. It has a frontal process where the zygomatic goes up and articulates with the frontal bone on the side of the orbit. Okay, there's a little hole right in the middle of it called the zygomaticofacial foramen. And that's where a nerve comes out and supplies this area around the cheekbone. Okay, can you find all those? You can stick the straw in them if you're so inclined. Okay, now the biggie, the maxilla, this thing in sort of purple lavender. It has an area that articulates with the zygomatic bone, which is referred to as the zygomatic process. It has a surface. It forms a part of the floor of the orbit in here. There's a big hole, there's a hole just below the orbit on each side, known as the infraorbital foramen, the hole below the orbit in English. The part where the maxilla goes up and articulates with the frontal, which you were asking about, is called the frontal process of the maxilla. The part down here where the roots of the upper teeth, you can see sort of outlined there, is called the alveolar process. And then where the right and left maxillae come together here, there's a little spine, a little bump, protuberance, known as the anterior nasal spine. Okay? The bones out here, the teeth, the roots of the teeth, you can see sort of protruding usually on the alveolar process. And these are, well, I'm sure you've had this in your other class, presumably by now. These first two are the incisors. And there's usually, the big bone out here is the canine, which has, in humans, has a fairly small crown, but has a fairly large root. And there's a little depression in there between the lateral incisor and the canine, referred to as the incisive fossa. And they're in front of the canine root. And behind the canine root, there's often a bigger depression known as the canine fossa. So those are just the depressions behind, on either side of the root of the canine tooth. Yes, ma'am.
So then the rest of the teeth are alveolar process.
The whole thing is the alveolar process, but there are larger gaps between tooth roots that have specific names. Basically, the one between the lateral incisor and the canine, one between the canine and the premolar. Yes.
These are only on the maxillary canines, or?
Yes. These fossae are just identified in the upper jaw, in the maxilla. And needless to say, if you were looking at a chimpanzee or your dog, the canine fossa would be enormous because they've got massive canine roots. Okay, looking from below, many of the same old bones, but they have obviously very different shapes. So here is the maxilla. The right and left maxillary bones come together, right, to form the hard palate, the front part of the hard palate. Behind them, the rest of the hard palate, the roof of your mouth, if you will, is formed by a bone called the palatine. And this is the palatine's here, but then it forms part of the nose and part of the orbit. We'll get to that. Behind that, what we see is this vomer that I was saying runs along inside the nose, separates the right and left side. And out here, and obviously there's one on the other side, here's where the maxilla and the zygomatic originate. So that's the zygomatic process of the maxilla. Back here, you see the frontal coming in. What's this area called again? That's our friend Pterion from another view. Okay, so here's the sphenoid. Remember we saw the sphenoid heading up on the outside. Here it is on the underside of the skull. And then it comes over here and has all these wings that have their own names. Okay. Behind the sphenoid, we have the temporal bone. Remember, this is the zygomatic part that's going to join with the zygomatic. Here's the external acoustic or external auditory meatus. There's that mastoid process we saw from the side, and all sorts of other things we'll talk about in a few minutes. Here's the parietal peeking out a little bit from there. Here's the occipital seen from below. What's this one called? Right. What's this area called? Asterion. Good. Okay, so you can see the occipital bone is huge back here, the back of the brain case, comes forward underneath, has this big foramen magnum there, and then it extends forward and articulates with the sphenoid and the vomer up front. Now, Friday we'll talk about how this occipital the formation is made actually by several different bones that fuse together and develop. Okay, more detail from this view. So here's the two sides of the two maxillary, right and left maxillary bones coming together. Okay, the median suture here. Okay, the median palatine suture. It separates the two halves of the hard palate. The front part is formed by the maxillary bone. The back part is formed by the palatine bones. There's a hole here just behind your central incisors, known as the incisive fossa. Okay, and within that there's a hole that passes, these openings here are called the incisive fossa, but there's a canal that runs from there up into the nose, known as the incisive foramen, to make life complicated. Palatine process of the maxilla. Remember, the maxilla has a zygomatic process up here and a frontal process over there. This is the palatine process, the part that's forming the hard palate. This suture across here, separating the palatine bone behind from the maxillary bones up front, is referred to as the transverse palatine suture. Okay, so here's the palatine, and like I said, it's a complicated bone. It's going in 3 dimensions in all sorts of directions. This part that you see forming the hard palate is referred to as the horizontal plate of the palatine bone. Right here, between it and the back part of the maxilla, is the greater palatine foramen. Further back is 1 hole or 2 holes shown here, the lesser palatine foramina. Usually there are 2. This is still the palatine bone. See, it's sort of got this little process poking out here. This little process that pokes out up against the sphenoid is referred to as the pyramidal process. And the lesser palatine foramina are lying in that pyramidal process, tucked back in here between the sphenoid and the maxilla. If we follow the palatine bone back, or the hard palate all the way back, there's a little protuberance right there, which is referred to as the posterior nasal spine. So that's sort of the back end of the hard palate in the mouth, and sort of the back end of the nasal cavity up in the nose, the nasal region. Okay, here, this opening here, which looks sort of funny from this direction, is referred to as a choana. It's the opening into the nasal region from the back. So there's a right and a left choana on each side, one on each side. Just how things get into the nose from the back, or things get in from the front of the nose back into your throat, like when you inhale milk or something. Okay, here's that vomer bone that's lying right here in the midline, and the sides of the vomer are referred to as the ala, the alae. Each one is a wing, the wing of the vomer. That's what you should see on the underside. Yes, Amanda?
Over the median palatine suture, is that the huge line?
It's between the right and left parts, the right and left maxillary bones, and the right and left palatine bones.
The palatine process is not actually the palatine, it's the maxilla?
Yes. Where are we?
Second from top.
The pyramidal process. Yes.
Palatine process.
These things are. Yeah. The palatine is not referring necessarily to that bone, but is referring to this is the hard palate. So remember, the maxilla's got a part that goes out to the zygomatic and a part that goes up to the frontal. The part of the maxilla that forms the hard palate is referred to as the palatine process of the maxilla. So it's the part that forms the hard palate and articulates with the palatine bone. Just like the zygomatic process of the maxilla is the part that articulates with the zygomatic bone, and the frontal process is the part that articulates with the frontal.
So it's like a right palatine process and a left palatine process?
It's generally, the whole thing is referred to, but yes, no, this whole thing is the palatine process. The part of this bone that articulates with the palatine, yes, each maxilla has a palatine process, if you want to look at it in that way, since it's symmetrical. So the right maxilla has a palatine process, the left maxilla has a palatine process. The whole thing is called the hard
But
palate.
it doesn't include the palatine itself.
No, this is the part of the maxilla that articulates with the palatine bone. Okay? Okay, this is the rest of the maxilla in gory detail. As I said, the part that articulates with the palatine lies in the roof of the mouth, is the palatine process. The part that articulates with the zygomatic bone is referred to as the zygomatic process of the maxilla. The part that articulates up here and articulates with the frontal is referred to as the frontal process. Okay, now let's go into this little bone that we talked about earlier. There's your lacrimal bone, which is sort of enclosed in part of the maxilla. This is the part of the maxilla, okay, that lies in the orbit, in the floor of the orbit. It's referred to as the orbital surface. This part up here, where there's there's a fossa here, okay, and there's actually a tube going down into the nose. This part of the maxilla is referred to as the anterior lacrimal crest. It forms a little ridge there, and then the posterior, we'll talk about in a minute, is formed by the lacrimal bone. So then you have a lacrimal fossa there. This is the infraorbital foramen again, the hole in the maxilla, lying in front of the orbit, just below the orbit, infraorbital, below the orbit. There's a big nerve and artery and vein that pass through there. This is the part of the maxilla that articulates with the zygomatic bone, known as the zygomatic process. There's the front lower part of the nasal opening, where we saw the anterior nasal spine. And then there are a couple of little foramina out here on the side, okay, for the posterior superior alveolar nerves and vessels. So there's some nerves that are running inside the maxilla there, and they send little nerves and vessels. They send little branches out here into the side of the upper jaw. And again, the area of the maxilla in which you have all these tooth roots is referred to as the alveolar process. We saw it from the other angle. The back end, the part of the maxilla that's behind the last tooth over here, is referred to as the tuber or tuberosity, maxillary tuber or maxillary tuberosity. And then the part that is behind the zygomatic, and the zygomatic arch runs from there, the part that's deep in there is referred to as the infratemporal surface. So this area back in here, which we will dissect one day, is called the infratemporal fossa. It's a big depressed area with lots and lots of bones in there, and lots of arteries and nerves and muscles and all sorts of things that you'll have fun with. Okay, so what we were talking about earlier. This is the little bitty lacrimal bone that lies in the medial border. This is the orbit out here. So right in the medial margin of the orbit is the lacrimal bone. And it has parts, no surprise. So there's an opening down in here called the nasolacrimal groove, and there's actually a tube that goes from the medial portion of your orbit down into your nose. And that's why when you're all upset at all the studying you have to do for anatomy and you're just crying and crying and crying, you have to blow your nose. Because tears